The lungs are vital organs in the respiratory system responsible for facilitating gas exchange between the air and the bloodstream. Structurally, each lung is divided into segments by anatomical boundaries known as lung fissures and lobes. These divisions allow for greater surface area and efficiency in the lungs and make it easier to isolate and treat specific lung diseases or conditions. This video covers the medical definition and provides a brief overview of this topic. So, if you're ready, let's get into it. Understanding the concept of lung fissures and lobes is crucial for healthcare professionals in diagnosing and treating respiratory conditions, as well as for interpreting medical imaging studies like chest x-rays or CT scans. In humans, the right lung typically has 3 lobes: superior, middle, and inferior, that are separated by 2 fissures, the oblique fissure and the horizontal fissure. The oblique fissure divides the inferior lobe from the middle lobe and superior lobes, while the horizontal fissure separates the superior and middle lobes. On the other side, the left lung generally has 2 lobes, superior and inferior, that are separated by a single oblique fissure. Each lobe is further divided into smaller segments known as bronchopulmonary segments, which have their own blood supply and airway branches. This segmental organization is particularly advantageous for surgical interventions, allowing for removal of diseased portions while preserving as much healthy lung tissue as possible. The fissures themselves are made up of double layers of pleura, which are the thin membranes that line the lungs and the inside of the chest cavity. They act as natural boundaries that allow each lobe to expand and contract independently, facilitating more efficient lung function. However, it's worth mentioning that variations in lung anatomy can occur, such as the presence of incomplete fissures that don't fully separate the lobes, or additional accessory fissures that further subdivide a lobe. From a clinical perspective, the concept of lung lobes and fissures is particularly important when diagnosing and treating various lung conditions like pneumonia, lung cancer, or a pulmonary embolism. For example, pneumonia may be classified as lobar pneumonia if it affects an entire lobe of the lung. Understanding the specific location of a tumor within a lobe can also help surgeons plan for a lobectomy, which is the surgical removal of a lung lobe. Moreover, understanding this anatomy aids in interpreting radiological images, thus helping healthcare providers pinpoint the location of abnormalities more accurately. But as you can see, lung fissures and lobes are integral in the anatomy and function of the lungs. They not only optimize gas exchange, but also serve as crucial landmarks for medical diagnosis and treatment. Familiarity with these anatomical features is indispensable for healthcare practitioners for effective patient care. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always,